Hi, this is Dr. Rodger Murphree, your FibroDoctor.com, author of Treating and Beating Fibromyalgia and Chronic Fatigue Syndrome. One of the things that I think is, such a challenge with fibromyalgia is there's so many daggum symptoms, right? I mean, you go to your doctor and you share with them that you've got all these different symptoms, poor sleep, low energy, the chronic pain, the IBS, restless leg syndrome, anxiety, and the list can be, rather long, unfortunately. And many doctors are quick to dismiss you as being a hypochondriac that's all in your head, or maybe you're just, which is terrible, but seeking, pain medication. And nothing could be further from the truth. I mean, nobody would make this stuff up. I mean, you just can't, and why would you? And so, specializing in fibromyalgia for the last 20 years and written 3 books on the subjects, including Treating and Beating Fibromyalgia Chronic Fatigue Syndrome, which is coming out in the 6th edition now, I have found that there's some really key things that if you will do, will drastically improve the poor sleep, the low energy, the pain, the IBS, this restless leg syndrome, the fibro fog, all these things that go with fibromyalgia. There's some key things that if you'll do, they'll lay the foundation and allow you to start to become successful in your quest to feel good again. Many years ago, I owned a very large integrative medical practice on the campus of Brook Hospital here in Birmingham, Alabama. I sold that practice in 2003, and my practice is now phone consults. I work with patients all over the world. But back then, I had 5 medical doctors who worked with me, and one of the things that we did back then, and this is 14, 15 years ago, we were doing intravenous IV therapy for our fibro patients because we found if we loaded them up with high doses, but the right doses of vitamins, minerals, amino acids, essential fatty acids, that they had less pain, they had more energy, their mental clarity improved, their moods improved, their sleep was better. And so we found by doing this that we could make some really big positive changes in their life. The problem was obviously, people coming from out of town would have to spend an hour and a half to do an IV therapy. And it was, it was uncomfortable. Nobody wants to sit in a chair and have a needle poked in their arm for an hour and a half. And the cost, it was, $100 or so per visit just to do the IV. And so years ago, I developed this thing called the CFS Vibro Formula, which is a high-dose vitamin, mineral, amino acids, essential fatty acid product that it has all the nutrients that you need for the body to be able to work correctly. And what I did with that is I substituted that for the IV. And what we found is our patients were now, instead of having to get an IV every week, as long as they were taking the CFS Vibro Formula, they maintained their positive results. So they had less pain, their energy was better, their sleep was better, their moods were better. IBS typically was greatly improved, so was restless leg syndrome. And from that CFS Vibro Formula, then I decided, okay, now what else can I do to help my patients to be able to handle some of these other things that are going on? And years ago, I came up with the same thing called the Jumpstart Program, which I talk about some in my book. But the Jumpstart pack is 4 products. The CFS Vibro Formula, which is high doses of vitamins, minerals, amino acids, essential fatty acids. You would have to take, 500 bottles of Centrum Silver or a 1 a day or whatever these ones that are out there. Those are not going to do anything. They're not strong enough. They're all based on the RDA. You can read more about that in the blog here. The link is here. Or what I call the recommended disease allowance. It's just enough to keep you from getting scurvy or beriberi. But it's not going to provide you with the results that you need, help you to reduce your pain, have more energy, help with your moods, the restless leg syndrome, IBS. You're going to need high doses. In some cases, the CFS Vibro Formula supplements are 500 times stronger than the RDA. Now, I learned this by trial and error over the last 15 years or so, because if I didn't have the right dose in there, my patients didn't see the results that we both wanted. Now, what I also did is I combined the CFS Vibro Formula with a real clean, simple, but pharmaceutical grade 5-HTP, 5-hydroxytryptophan. Many of you have heard me talk about the importance of that. The 5-HTP that I use plus the CFS Vibro Formula, that helps to make serotonin. And the higher your serotonin level, the higher your pain threshold, so the less pain you have. The The higher your serotonin level, the happier you are, less anxious you are, the less likely you have IBS, restless leg syndrome. So the 5-HTP is in there. Now, the other thing I found was that once I got my patients sleeping using the 5-HTP and the CFS formula, they had less pain, they had more energy. But the problem was that they would then overdo it. And that's normal. I mean, you hadn't felt good in years, so you have a good night's sleep for the first time in a number of years, actually have some energy to do something. Then you go out and you overdo it, and then you crash. You have a fibro flare. What I found was if I could get my patients to start repair their adrenal glands, these are the stress coping glands that allow you to have stamina and resiliency to stress. By doing that, they found that they were able to do more, have more stamina, more resiliency to stress, and had less fibro flare. So that's why the adrenal cortex is in there to repair that. It helps with, for those people who had their get up and goes, got up and went, that's adrenal fatigue. So the adrenal cortex starts to fix that. It helps with mental and physical energy, helps reduce pain because it has an anti-inflammatory effect. But probably the most important thing is it allows you to have stamina and resistance to stress so you can do more and be less likely to have a fibro flare, whether that's to go out and have lunch with friends or to travel with your family or just to cook a meal or go to the grocery store. Very important that my patients that I'm working with take the adrenal cortex and start to repair the adrenal glands. And then the last thing I found was it didn't matter if I put my patients on the right supplements and even change their diet, which I recommend you do. Go into detail about that in my book. But I found if they were not digesting their food or their supplements because they had problems with malabsorption, leaky gut, yeast overgrowth, bacterial overgrowth, whatever it is, reflux, GERD, these things that are happening with my patients, then they couldn't absorb the nutrients and they didn't get the full benefit of these supplements or the foods that I recommend. So I put everyone on a digestive enzyme, which allows them to digest not only their food and get the nutrients out of there, but also to be able to digest the supplements and make sure those are being broken down and utilized by the cells properly. This was a huge, huge breakthrough for many people who have been trying to do it on their own for a number of years, took a lot of supplements, tried to eat well, but never saw a difference. So what we saw when I add the digestive enzyme is that reflux would typically go away. Irritable bowel would greatly improve, oftentimes go away. We would see that malabsorption where you eat and then just sits there all day and you're bloated. The bloating, the gas, the stomach pain would go away once we started using the digestive enzyme along with these other products. So I want to encourage you to join me Wednesday night. I'm going to be going over into more detail about what you can do to lay the foundation to get healthy and to feel good again. In the meantime, I want you to read this blog if you've not done so and learn more about why high doses, but the right doses of vitamins, minerals, amino acids, and essential fatty acids are really the building blocks of our cells and control how we feel, how we think, our pain, our digestion, our elimination, our immune system, controls our sleep. All these things are controlled by these natural supplements or nutrients that we should be getting in our diet and then often are not. So this is Dr. Rodger Murphree, your FibroDoctor.com, author of Treating and Beating Fibromyalgia and Chronic Fatigue Syndrome. Join me Wednesday night, 6 p.m. Central Standard Time, every Wednesday night, where I'll be sharing information to help you in your quest to feel good again. In the meantime, check out the blog that I wrote and look forward to seeing many of you Wednesday night.